Very good morning. So, the subject is data science in healthcare, and today's topic being discussed is role of a data scientist in healthcare. So, first one is why you need a data scientist in healthcare, right? Now, healthcare data will be generated from what? Healthcare data will be generated from electronic health records, laboratory reports, medical images, clinical notes, prescriptions, claims, disease registries, clinical trials, genomic data, wearable devices, public health databases. So all these data are heterogeneous, distributed, incomplete, sensitive. So naturally, the role of a data scientist is required as he has to convert this heterogeneous raw data into some useful, meaningful data upon which some actionable insight can be derived. Now, what is the major role of a data scientist in healthcare? He should not immediately start building the models as he knows machine learning or as he knows data science. He should first understand the healthcare problem. Then he should collect the relevant healthcare data through various sources like electronic health records. Then he can integrate that data because the data is derived from multiple sources. He has to integrate that data. After integrating, typical exploratory data analysis he may do for cleaning, preparing and harmonizing the data. And when he does that, he may be handling missing values, duplicates, inconsistent formats, coding differences, terminology differences, standardization, validation, etc. Then he need to use descriptive statistics to understand the data in a better way, to visualize the data, to identify the patterns, relationships, outliers, biases, etc. Then he can apply his machine learning knowledge and algorithms, statistics knowledge and algorithms to resolve the problem. So he should develop and validate models for risks such as readmission or disease progression or complications or appointment no-shows or other outcomes. He should support clinical decision making. He should be able to translate analytical results into risk scores, alerts, recommendations, other decision support information. He should communicate insights through visualizations. He should create a lot of dashboards, reports, visualizations, which will help the doctors, hospital people, and related researchers to understand and act on the various findings. So he should also ensure responsible and ethical use of the healthcare data because the healthcare data is related to patients, people whose privacy, security needs to be taken care of. So he should be able to address biases. He should adopt explainability, and he should use the appropriate healthcare model. A typical healthcare data science life cycle can be: first, you need to identify the problem. You need to identify the data, then collect the data, integrate the data, clean the data, harmonize the data, do exploratory analysis, apply ML models, do video validation, visualization, communicate, decision support, monitoring and improvement. Now, there may be different domains in healthcare, and the role of a data scientist may vary in different domains. For example, healthcare area, say, is clinical care. He should be able to do risk prediction and decision support. If it is disease diagnosis, he should be able to help in pattern recognition and predictive modeling. If it is medical imaging, image analysis and classification. If it is patient monitoring, so continuous patient data has to be monitored. If it is public health, he has to do surveillance and population analysis. If it is hospital management, so optimum utilization of resource and capacity of the hospital. If it is pharmaceuticals, speed up drug discovery and safety analytics. If it is clinical research, so he has to do analysis of clinical trial and observation data. If it is personalized medicine, so he has to give patient-specific risk and treatment analysis. If it is visualization, dashboards and lot of decision support reports. If it is healthcare NLP, information extraction from clinical notes. If it is privacy preservation, so he has to apply federated learning and federated analytics. What are the skills required for a data scientist? It can be multidisciplinary. For example, he should definitely able to grasp some knowledge of healthcare, right? What is a claim? What is a patient data? Various terminologies related to healthcare, electronic health records that he has to understand. Then the typical knowledge of data science, data engineering, and typical knowledge of communication, working in team with multidisciplinary skill sets. He should follow ethics. He should ensure privacy. All those aspects are required. So let us take one example here. Say we want to predict hospital readmission for a patient. So, and what is the problem being given? We need to reduce the 30-day hospital readmissions. So for that, again, we need to identify the data, integrate the data, harmonize and clean the data, then uh, build a readmission prediction model, visualize the high risk patient through a dashboard, communicate results and limitation to clinician, support clinical follow-up decisions. So coming to the books from where this data is derived is Andrew Nguyen's Taming the Complexity of Real World Data, Catherine Rovel's book, Visualizing Health and Healthcare Data, Chandan K. Reddy's book on Healthcare Data Analytics. So I have some statistics here. Say for example, you can refer page number 1 to 16 of Nguyen, then Brown's book, page number 9 to 19, Reddy and Agarwal's book, page number 1 to 15, like that. Thank you.